relied on a lot of the staff at the university and my professors, and I really struggled in my master's degree. I was not the top of my class, and I remember waiting outside my professor's door for like over an hour. And I remember him telling me, it's like, look, he would say kind of like, you're not really a champion, but we just kind of want to get you out there. There's a job for you. There's a role for you in public health. You just need to get this master's in public health and get out in the field, and you'll do, good things. But I was not the top of my class. I never thought I would have a PhD. I just, I really struggled in the master's degree. I had a really rigorous professor. He was really structured with research and APA and his approach to behavior health, which now I appreciate because mental health is such a massive issue. And so he was very structured, but he was a really great mentor for me. I really needed that hardcore structure.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. First and foremost, if I met you at APHA or this is your first time interacting with this podcast was through learning about me at APHA, thank you all so much for joining. Be sure to subscribe and share it with a friend. This will be greatly helpful in getting the show out to more people. And I will be taking a break in December just to get some more rest and relaxation and recuperate and really come back for the new year for you all and for myself as well. So thank you for that patience and that grace as well. Today's guest, Dr. Annette Padilla, PhD, MPH, sMBA, works as an associate at Interim Public Management, Chair Grants Committee at the U.S. Department of Health and Human Services, Family and Youth Services Bureau, as well as a substitute teacher for preschool and K-12 at Mesa Public Schools. She's a drug problem prevention expert using policy and strategic planning to drive forward social justice. She's also an evaluator, director, leader, federal, state, and local government manager and consultant, a policy scientist, and expert strategic planner. She conferred a Bachelor in Health Education, then a Master in Public Health at San Diego State University. She got her PhD in Public Policy and Administration, Nonprofit Management, and Leadership at Walden University. In today's episode, you'll hear and learn more about using policy and strategic planning to work towards drug prevention, the learnings from working in K-12 and higher education settings as an educator, as well as teaching business and English overseas in China, Vietnam, Saudi Arabia, and South Korea. You'll also hear about the work that she has done with her consulting organization, and much, much more. All that I ask is you subscribe and that you share this with a friend. Enjoy the episode, everyone.
Hi, I'm Annette Padilla, and I'm a management scientist. You're listening to Public Health Careers.
Welcome to the show, Dr. Annette Padilla. I'm so excited to have you on today.
I'm excited to be here. Thanks for the invitation.
It is my pleasure. I know before the show, you're talking about that you used to do media recordings and radio recordings, and we're talking about how that was a lot more sophisticated than this. But regardless, we're able to capture your story and share your insights, and I'm looking forward to hearing more about what you do and how you've gotten there.
I am too. Thank you.
Yeah. So how do you identify and tell us a little about your personal background?
Sure. So I'm half Latino and the Jewish descent. And I'm basically a public health advocate and a PhD scientist. I live in Mesa, Arizona, and Phoenix Metro. So I'm an international PhD and a global management scientist.
That's awesome. And I feel like I haven't interviewed too many people in the Arizona space, but I was in Arizona a couple months ago, and my first time being there, and it was really beautiful. The red rocks really did steal a little bit of my heart, and all the cacti.
It's really pretty, yeah.
Yeah, and a wide variety of cacti, which I took many pictures with many cacti because I've never seen so many cacti in my life.
So yeah, it's really pretty, and there's a lot of opportunity for public health work here.
Okay, and we will learn more about that in a little bit. You're a content expert in preventing drug problems using policy and strategic planning, and you directed many programs related to social justice. Can you share more about this?
Sure. So I started my career back in the 80s, actually, as a volunteer and as an intern for the Trauma Foundation, which was based in San Francisco. And we were doing work with a group called the Institute for Health Advocacy, which later became the Institute for Public Strategies. And we started doing work around media and policy and basically a circular model which focused on policy reduction to reduce alcohol and other drug problems. And so it was a lot of work with the community and advocacy to generate policy change. Those policy changes, Amari, really benefited the community, low income communities of color. And so the work we did was very progressive in California, based on social justice philosophies and the work of Martin Luther King and Cesar Chavez in terms of, supporting farm workers and that kind of thing. And so the work we did was built on those philosophies and foundations.
And what are some of the things that you all had to learn in like reaching the community to teach them about advocacy as an important part in this work?
So we did a lot of coalition building with neighborhood groups, with grandmas, with youth, with law enforcement, school personnel, basically depending on what issue we were addressing. If we were addressing tobacco and like smoke-free restaurants, we were targeting schools and youth and health advocates. We would build these coalitions strategically and invite people to the table and then organize policy goals. We would develop position statements, look at data, look at evaluation, look at the policy around that model of enforcement, policy, data, and develop campaigns essentially that were government funded, county funded at the time, to work on what we call environmental prevention. That's addressing public health problems with policy, which is the best use of the public dollar, essentially. It impacts the most amount of people. And the smoke-free restaurants is like the best example of a public health policy change, a law that benefited everybody in our nation, essentially.
Yeah, thank you for sharing that. And I think the important parts like around like coalition building and really figuring out like what are the priorities, what are the goals that we're trying to hit, and like framing everyone around that and having that vision is so important. And yeah, when we're able as public health professionals, practitioners to really affect policy change, that's when we get the biggest bang for our buck and the largest amount of prevention.
Definitely.
So you are also a substitute teacher and educator. What insights have you gained from working with diverse students in both K through 12 and higher education settings?
It's quite interesting, Omari, because I've spent a lot of my career in education and in business and teaching English and teaching strategic planning and different topics, working with college students, and then recently with K through 12. There's a great need in K through 12 for more resources, more sophistication, especially in Arizona. We're 48th out of all the states in terms of educational outcomes. And so many of the youth don't want to be in school. They're angry. They're depressed. Even like at the first grade level, the kids can identify their feelings. And they said, Dr. P, or sometimes they just call me Doc, I'm sad, I'm depressed. And many of the classrooms have like calming rooms, calming areas for them to kind of like chill out. And it's interesting because when I went to school, we didn't really identify our feelings and we didn't really have those feelings. So I give the kids lots of credit because they are sophisticated in order to identify those feelings. But at the same time, our society has created an environment for them of one of stress, of one of anger, one of isolation. And you really see this at the elementary school and more so at the junior high level, where there's a lot of disrespect and anger and the kids don't want to be there. So it's a real shame. And it's not all the schools. There is some like 5 or 10% and some academics, some elite students, but the majority of the kids are really struggling in the school system. And you could see it with the teachers too. They're struggling, and the facilities are quite outdated for the needs in the classroom as well.
Yeah, that's important work, and I could imagine coming out of the pandemic, if people want to say that, kind of might look like we're going back into the pandemic. But coming out of the pandemic, there were a lot of mental health issues and isolation being an issue, and then a lot of youth, children losing that face-to-face interaction, that in-person interaction, and really not really having the solutions or the systems in place to really support them. So I could understand that. And to your point as well, I do believe that youth these days are a lot better at identifying their feelings, which I think is a good step in the right direction, because many times we didn't have the words to share what we were feeling at that point in time. And shout out to those schools that are instituting care rooms. I know I've heard it called a couple different things in a couple different places, but really focusing on how can we create an environment that supports the whole student and appreciates that everyone isn't going to be okay all the time, but how do we give them the tools and techniques to really be able to soothe themselves and calm down and realize that they're amped up, and we need to get them down more to a calm state.
Yeah, those are important points. Yeah, definitely.
And you mentioned about you used to teach in higher education around strategic planning. Can you tell us maybe some things? Because many people listening to this podcast would be doing some sort of strategic planning at some point in their career, whether for their nonprofit or for an organization that they're working with. What are some of the important things that you always make sure people know when they're going through a strategic planning process?
Sure, great question. So I started teaching for many universities. I was an adjunct professor in California, and I ended up teaching many courses in healthcare administration, for example, training hospital administrators. So essentially, a lot of strategic planning efforts would fall back on data in terms of looking at the problems, looking at the main objectives and goals of a facility or a hospital or patient care plan. And so looking at data is always important in terms of the goals, also the getting the buy-in of the administration, or even getting patient input. Community input in the strategic planning process is important, as well as staff, because they're actually going to be implementing the plan. And so I've worked quite a bit with like law enforcement agencies and a large like child abuse prevention organization in order to help them develop their strategic plan, which was led by their board of directors, also the staff. And so we would go through like the different goals and the objectives and the measurement, also their values, encouraging them to think about like diversity and equity issues in terms of that strategic planning process as well. But then having a document that they can really use and having the performance measures included in the plan. And I would sort of just ground them in the data, like making sure that their goals are going to be able to be reached and that they're reasonable, and also being able to look at the business analytics, like looking at their competition. And that's one of the things I bring in. As a public health professional, I also have studied as a scientific MBA certified PhD. And so looking at the business angle, how can this nonprofit compete with their another nonprofit that is in their geographic location? So bringing in the business and the competition to it, because even though you know that you're doing novel work and important work, you're always going to have a competitor. And so looking at your a sister agency or somebody in a different state, seeing what they're doing and bringing in the innovation into the organization is something that I bring to the table.
And I appreciate you sharing that you start with the data, because many times we might have like anecdotes in our heads of where we think things are, but when we actually get the data and we lay it out there and we put it in a way that we can actually see it, like, oh, okay, this makes sense that this should be the thing that we're trying to tackle right now with our resources. And then from there, kind of pivoting and understanding where are those points in that data that you can put things in place to leverage the most amount of change. And we'll definitely get more into that sMBA, PhD a little bit later, because I think that in itself is fascinating. But before we go on, I have to ask you, what does public health mean to you?
I fall back on my training in public health, and I started in community health, and then got my public health degree. For me, I was trained it's the absence of disease and infirmary, but essentially, it's well-being, good mental health, prevention is really, I think, important and always underfunded and misunderstood by the public. I think COVID was a great example of people not trusting scientists, not understanding the process with preventing, disease transfer, wearing masks, and, looking at data and vaccines. And so I think public health is so important. We're always going to be advocating for funding and always trying to explain to the public what it is, essentially. And I think when we explain what public health is in terms of measurable and dollars saved, like taxpayers' dollars that are saved, that people listen more about that and know that we're not just spending money. It's not like a welfare program or food stamp program. It's really to prevent people, and creating economic opportunities.
I was going to ask you like how to reframe the thinking of prevention, but I think you answered it there very perfectly. It is many times to my dismay that we in public health have not been able to vocalize just how effective we are and saying this is the dollar amount, because many times the systems that we are trying to think about to improve, they're thinking about it in a dollar spent perspective. So why can't we share this prevention action program, whatever, is giving us this amount of dollars saved? And then that really helps people to visualize why this is important, because many times you're not thinking about public health because your water is working fine, so you have no need to think about it. But what is the benefit there for the community, for the taxpayers, is an important perspective. So I appreciate you sharing that.
Sure.
And you got your bachelor's in health education at San Diego State University, and you went on to get your master's of public health there as well. But we'll stick to the bachelor's in health education for the moment. What was your thought process going into undergrad?
Well, I actually started as a nursing major, Amari, and I just couldn't really realistically follow the track into biochemistry. So I switched over to community health education, and I had a great time. I was an intern in sex education at the time with the Society for Sex Education, and I was an intern in the jails in juvenile hall, teaching tobacco education, bringing in the dirty lung and showing the dirty lung, please don't smoke, to juvenile hall. And I was a dental hygiene intern. I went to the schools and talked about how the kids can brush their teeth and floss, and you could see a lot of the kids didn't even have toothbrushes, for example. I worked in very low income areas in San Diego. So I had a lot of different internships during that time period, and it really gave me a sense for community health. I was quite active in drunk driving prevention at this time. We were passing out like materials in bars, Red Ribbon Week. People were wearing red ribbons, and we were saying, please don't drink and drive. And so that's how I got started with those basic campaigns and doing a lot of volunteer work and a lot of community service, essentially, to get messages out.
Which is important, especially early in your career, to build those experiences, get exposure to the field, understand like what is this I'm learning in class and how does this actually translate to real world life. So being able to understand that, I think, is important, as well as I think the importance of doing things that you may not like, because in learning that, okay, this is something that I don't want to pursue, or like this specific part of public health is not what I'm interested in. Let me find experiences that expose me to other parts of it, which I think is also fundamental as well.
Yeah, and I loved it. I was on the board of directors for the Health Clinic Association. It's called American College Health Association. I did a lot of national conference planning and regional conference planning with the student section of that. And so it gave me a chance to be on a board of directors of a national association. Also, I was later in the student government as an elected official, and it gave me a chance to learn parliamentary procedures. So I had a lot of involvement in advocacy for public health. At the time, this is when HIV just came out, and Magic Johnson was HIV positive. We were passing out condoms and getting condom machines on college campuses, which was like a real reform at that time.
I can only imagine. And So you got your bachelor's in community health education. Would you say that is like equivalent to a public health degree? Was public health something that you learned, like the term public health or the field of public health? Was that something that you learned as you were progressing in the program?
Yeah, a little bit. I mean, I knew I wanted to go on to get my master's degree, and I was really interested in public health and research, and the MPH was quite well known at the university, and everybody that was kind of like the A student did advance into the public health program. I was not really an student. I was not the top of my class in any of these programs, but I really was motivated and wanted to advance on into the university to get a master's degree.
And I think that's important for people to understand as well. You don't have to be an A student to do great work, to be a good student, because there are many aspects of being a student outside of that specific academic grade that you're getting. So thank you for highlighting that. So you named a couple of the different internships and experiences you had during undergrad. I will name a couple others that you also had, and if you could just briefly touch on them for a second. So you were a Youth for Understanding foreign exchange program to Germany. You were a certified nursing assistant at Beverly, and you were a community organizer at UC San Diego Extension.
Sure. So I went to Germany my senior year of high school, actually, to live with a family in the country in a little town called Niederhausklau outside of Siegen between Cologne and Frankfurt. And it really gave me appreciation for the culture and global affairs and communication. I really couldn't communicate 100% to my family. So I worked with my siblings and learned as much German as I could. German is a really simplified language. They only have a few words, and I was not fluent going over, but I took that experience and really learned a lot culturally from being there. And I also I'm sorry, I lost my train of thought. Well, we were
Certified nursing assistant in Beverly and community organizer at UC San Diego.
So I was a certified nursing assistant. I worked for Beverly Manor. I was like 18 years old at the time and in college, and I would basically clean bedpans and take temperatures. I worked a lot of night shifts. It was really, really hard work, but it really gave me an appreciation for nursing at the time, and really the hard work that nurses go through. I remember like how my feet were so tired from standing and running to all the patients' rooms and all of that. So that was a really great experience too.
Yeah, that sounds like a fundamental experience in just understanding more about the healthcare system and the employees in those healthcare systems. So you were sharing a lot about how this was like you developing more of this health education, this public health perspective in undergrad, and then you went on to pursue your Masters of Public Health. Before we get to your MPH, did you have any undergrad takeaways that you wanted to share with us?
I guess I just want to talk about some of the community organizing work I did with the 4 campuses. So I worked with 4 campuses in San Diego to prevent impaired driving. That was a community organizing project too with college students, and that was policy based as well. So I guess, when I was in college, it was like the time of my life. It was really interesting. We were protesting fee increases with the CSU system. And we had an opportunity to, weigh in on public policy there. Also, I was in a sorority, so it gave me a real social grounding for academics and leadership in terms of being in an organization and having an office and an organization, being elected to do something. So that was really fun, and just all the different things to do on the college campus. I lived on or near campus all of my bachelor's and master's program, and I just loved it, and I just had a great experience. It was really the time of my life. And San Diego State was a party school at the time, and so you could really apply that to the drunk driving prevention efforts that I was working on as well. It was a real kind of hub for preventing youth drinking problems.
And looking back on your career now, like how impactful were those experiences that you had early on in your undergrad to where you are now?
Well, I think it was interesting when I knew I wanted to go into my master's, and so I quit smoking. I was smoking at the time when I was an undergrad a little bit, so that was impactful. Also, just all the internships and getting my name out, and now I'm going through like the same process, getting reestablished as a public health professional, getting my name out there, and you do that by volunteering and basically taking leadership positions and using your ethical voice and advocating for underserved, et cetera. And also I've worked with a lot of special interest groups, or what we call affinity groups now in government. Like I worked with MECHA, which was the Mexican, I worked with Samahan, the Filipinos. I worked with the African Union. I worked with the Gay and Lesbian Union, all these different special interest groups on the college campus, which gave me a real, further respect for the melting point, the melting pot that we had in California and the diversity of viewpoints. And they had like a Republican association. And so, I mean, just being on the college campus, it was a real hub and exchange of ideas. So,
And after your undergrad, you decided to pursue a Master's of Public Health at San Diego State University as well. Tell us more about that thought process in deciding to pursue this graduate degree.
well, I knew I wanted to get more involved in research, and I have a higher calling. I just wanted to excel. I was the first person in my family to even seek a bachelor's degree and go to college. In my family was primarily Mexican, and my grandma had 10 children. There wasn't enough money for people really to go to college. And then I came from my mom grew up on a farm. So she really didn't have the opportunity either. Back then, you didn't really have to. And so I was the first one to really chart out, my dream, and, wanted to excel and keep moving. And I had a lot of scholarships as well from all those internships and connections I had. And so I partially funded my education through those scholarships as well. So I just knew I wanted to contribute at a higher level. And I had good relationships with my professors as well. And because I did a lot of volunteer work with the public health community in San Diego with the county, I had access to researchers and was reading research and getting to know research methodology. And so that really piqued my interest.
Okay, so wanted to get more involved in research in public health. This is fascinating to me because I feel like many times, and not the research part, but you being the first one in your family to go to university, because I feel like many times when you're a first generation person going into college, you don't seek out all these opportunities, or you just don't know how to seek out these opportunities, or you don't know what the benefit of them are. But you really put yourself out there to get a whole host of experiences, regardless of like not having like quote unquote mentorship from family members who would have known how to navigate the system. So like that is huge. And that is like something I don't want to understate how important that is. Like regardless of not having people that might know how to navigate the system, you said, I'm in this position. Let me get all the experiences and gain as much as I can. And then from that, you weren't even scared. You're like, let me do this master's program because I know it's going to teach me more of the things that I need to know as well.
Yeah, I mean, I relied on a lot of the staff at the university and my professors, and I really struggled in my master's degree. I was not the top of my class, and I remember waiting outside my professor's door for like over an hour. And I remember him telling me, it's like, look, he would say kind of like, you're not really a champion, but we just kind of want to get you out there. There's a job for you, there's a role for you in public health. You just need to get this master's in public health and get out in the field, and you'll do good things. But I was not the top of my class. I never thought I would have a PhD. I just I really struggled in the master's degree. I had a really rigorous professor. He was really structured with research and APA and his approach to behavior health, which now I appreciate because mental health is such a massive issue. And so he was very structured, but he was a really great mentor for me. I really needed that hardcore structure.
Yeah, absolutely. So definitely find those people that are able to help and support you through that journey, especially when you don't know where to get answers. Reach out to people. There will always be someone that would be able to support you. You just have to actively seek them out. I also want to highlight the point of you saying, or like the professor and you saying, like, you're not the top of your class, but you still, all you have to do is just complete this degree and then you can start to make your impact. And I think that goes back to the point I was sharing earlier. It's like academics is one part of it, but many people who are good at academics might be able to implement what they're learning in an actual real life setting. So there's just levels to learning. And I think just being open and understanding that your grade does not define you, and all the other things don't define you, but you and the decisions and the actions that you take are the things that define you.
Yeah, I definitely made a contribution to the university and to the student body, and I was not at the top of my class, but there's always a place for people. You just have to keep advocating for yourself.
Absolutely. And during your MPH program, you were a health educator at the Health Center Partners of Southern California and a community organizer at Pathfinders of San Diego, Inc. Tell us about those experiences.
Sure. So I ended up getting a job at the Council of Community Clinics. That was the name before they changed it. And I worked for the African American Tobacco Prevention Network. And my boss was African American. And I learned about black eyed peas. He had us over for dinner and sweet potato pie. And I learned about African American or black culture, essentially, because I was the only one who was not black at the conferences. I remember seeing these women in these beautiful headpieces and the dresses, which has always intrigued me to this day, to go to Africa, to the continent, and learn more about the culture. But I learned a lot about the different affinity groups had different prevention networks. The Latino had a network, the African Americans and the Asians, everybody kind of had their own network with tobacco prevention. So I worked there. I did that. And that was a really interesting experience. So with Pathfinders, that was kind of a part-time job I had from one of the internships. It was the same group of collective prevention providers that were county funded, and it was a recovery office for alcoholics, essentially. So people would come in for like a cup of coffee, and I learned a lot about Alcoholics Anonymous and AA programs, which are as effective as being on meds or therapy for alcoholics, essentially. Basically talking and sharing your experience. And so I learned a lot about that. But at the same time, we had a lot of public health policy campaigns we did countywide to look at policies with underage drinking. And we had a lot of high-level officials and board of supervisors and high-ranking military officials on our policy panels. We would have experts and PhDs come in, and we would have people who are struggling with their own drug problems testifying as well. So it gave me a chance to work on developing testimony for people, looking at research, and working with high-level officials in their offices, for example. And so those gave me a lot of skill sets that I use today, essentially diplomacy and working with elected officials and developing, political testimony, that type of thing for people.
What advice do you have for people that might be new to working with elected officials?
I mean, just, don't be intimidated. There are people with power, and we all have a sense of power. Typically, it's how you manage your power, but don't be afraid of those people. They're people just like us. And, they're just wanting to give back and to the community. And we're really there to, to support them. And we're, as public health people, we have a lot of knowledge and advocacy and power to give back to the community as well.
Did you have any MPH takeaways that you wanted to share with us?
I think one of the most important things that I saw and experienced was doing rigorous research. I think a lot of MPH people might want to test out of a program or write a paper like a lit review. I really would advise against that. I think doing rigorous APA-based research, doing a study is really important. I think you'll always be able to fall back upon that. A lot of people go back later for a PhD or doctorate. And if you have that sound APA training and the research design and the ability to synthesize and read and understand research, that's really going to help you with a PhD and understanding data and research in the future. So I think doing rigorous research, and I know a lot of the master's programs started graduating people like after a year. And, all the people who are kind of getting cranked out really quickly with master's degrees. And my program was very rigorous. So I think just making sure that you get the grounding and the rigor for science is I think really important.
That's a good perspective because at the end of the day, you are paying for this education. So like really trying to understand how can I get the most out of this? And like to your point, a lit review, while helpful, while good, you're not getting the rigor that you can get from doing more tangible research. So that makes a lot of sense. And I think it's something that people should think about as they are going into their master's program, and especially if they're thinking about pursuing a PhD afterwards.
Right. And you never know when you might want to pursue a PhD or have the opportunity to pursue a PhD. So having that background will save you a lot of time.
And after you graduated, you were a director at the YMCA of Orange County. Tell us about getting that first job after your master's program and what did you do in it?
Sure. I love that job. Actually, I had a connection through all my volunteer work in San Diego. One of the consultants, she worked on the methamphetamine task force. She recommended me for the job in Orange County. I was down in San Diego. And basically, it was a county funded operation and run through the YMCA, the nonprofit up there. And it was really tasked with two tracks. And I've faced this in my career a couple times. One is there's a problem, which was they were doing mentoring instead of policy work. And then the other task was run the program, manage it. And so I faced that a lot in my career in terms of problem solving and then managing the operation. And so when I came, we had a lot of staff turnover, and so I had to rehire staff. So getting the HR skills are really important for MPH to have those HR skill sets with hiring and supervising and monitoring staff. So I hired staff and I rebuilt the coalition. So rebuilt the relationships with the cities. We service 7 cities in North Orange County, Placentia, Anaheim, Brea, those cities kind of in that little corner in California. And so I rebuilt and redesigned that program. And we did a really great job working on local control, working on ordinances, conditional use permits, essentially to look at ways that the cities could reduce alcohol advertising on alcohol outlets. And we had server training in bars and restaurants to prevent underage drinking and driving. So that was a really great project. I think in public health, you always have to be ready for the change because there's always political changes with the funding, which our funding was discontinued after 4 years. And a lot of my funding opportunities capped out, and I basically lost funding and lost positions and then had to rebuild and get another job. But that position was really interesting because we had a lot of grassroots, like door-to-door campaigns, working with neighbors, and we trained neighbors how to write letters to the editor and interview in front of the TV. We had press conferences. It was a really novel program, and it also gave me an opportunity to work on contracts. So I had a lot of contracts with other PhDs and experts. So one of the things I learned in California, Omari, is as a public health practitioner, sometimes we didn't really know what the solution was. So we would call up the researchers and say, hey, what are you working on? Can you give us some advice? And some of them, we would have these experts on contract. And so that was a really nice opportunity to be able to work with other PhDs. Sometimes it was like a $5,000 contract. I mean, it was like really, small in terms of what we do now. It was like $10,000 or $5,000. But just having the expertise on hand then allowed me to have the expertise and transfer it into me, and I could then transfer it back to the community. And so it gave me an opportunity to get closer to the research as well, which helped me with my PhD later.
That makes a lot of sense, and that's a great point to highlight there. Just how we don't have to know everything, but being able to know the people that know everything who can teach us how to learn those things are so important, and a skill that we need to develop, especially as we get higher into our careers and like managing teams and different things like that.
Yeah, it was quite interesting.
And how was that, like being a director right after your MPH program?
I loved it. I loved the staff and managing and the contracts, working with the experts. I also love the community, working with the grandmas and, the youth and the advocates, also working with the city officials, work with city attorneys and planning departments. I loved all of that. and really the fiscal pieces with the YMCA. And I learned a lot through that process. Yeah.
Right. And then after this position, I'm gonna name the next two positions that you had, because you had a few other positions that before we get to your PhD. So you were a program coordinator / student health services prevention at California State University, Long Beach, and then you were director of Century City Equal Opportunity.
Right. So I was living in Long Beach at the time, and I got a position with the Student Health Center there. It was very similar to the work I had done in college health, and it was a Department of Ed grant with the feds, and it was focused on drunk driving prevention, coalition building, strategic planning, looking at drug problems on and around the campus. And so we formed a coalition with the law enforcement and with the city, or actually, I'm sorry, with the campus administrators and the public health, the health center staff. And we looked at some problem assessment on and around the campus. So that gave me another opportunity to do some strategic planning. And I love that job. I would ride my bike to work every day. And, I lived near the campus. So it was just a great opportunity to be on the campus. Also, I was a part of a union there. I was unionized staffed. And so I think any opportunity you get to work with labor groups or unions is really going to help you in the future. As right now, unions are really protesting and having a higher say in their wages. And I think understanding the unions has really helped me in my career as well.
Yeah, that's awesome to hear. And I was reading this book, Poverty by America by Matthew Desmond, and he talks a lot to the point of how the systems and the corporations have really tried to shut down unions and the impact that has had on poverty and as a result, all of the other social determinants of health. So that I definitely think, to your point, how valuable it could be to just be in that space and to learn what you need to learn there.
Yeah, it was interesting.
Yeah. So you're also a grassroots organizer for LA County Public Policy and Public Affairs for California Association of Facilities. And then you were a training and technical assistance project manager, development officer, consultant at the Institute for Public Strategy. So tell us about those two positions.
Sure. I went to work for the nursing home industry. They call it the California Association for Health Facilities. And I was a grassroots organizer. So I was responsible for LA County for all the nursing homes there. And I did a lot of work we had a campaign with Family and Friends, for example, and I would host legislative visits in the nursing homes for elected officials. And this was at a time where the nursing home industry was sort of in a crisis. They really didn't have the funding they needed for the facilities. There was some elder abuse situations going on back then, but it gave me a great opportunity to work statewide. We had a lobbyist in Sacramento that I reported to, and also public affairs staff. I got out a lot of press releases, so I was able to build on my media advocacy skills, working with media statewide. So it was really a great opportunity, and we had a lot of conferences, and I reported into the National Association as well. So I really enjoyed that, and I worked with other interest groups like ARP, the Older Americans Association, retired people in Los Angeles as well. So that was a really interesting position.
And how about the training and technical assistance project manager, development officer, consultant at the Institute for Public Strategies?
So I really loved IPS. IPS was born as Institute for Health Advocacy. That was the group I was an intern for down in San Diego. So they grew into IPS and really a major think tank with environmental prevention, with the use of public policy, and working with all the PhDs and the researchers. They had a border project in San Diego and Tijuana that focused on reducing alcohol problems in the bars in Tijuana, which I got to be a part of. And that job was really interesting too, because it really gave me a sense for working on different projects. My boss was really a great manager, and she would split our time among many projects. You got to work on many, many projects at that time. Also, I was tasked with a program to sophisticate the the methodology with many of the county providers. So I ran a training and technical assistance program that was built on with the experts, the PhDs who were doing novel research, bringing them into rooms with us to share with us their findings, their expertise around this model with policy and evaluation and research. And we would have book discussions about who moved my cheese at the time, like organizational development topics as well, to really sophisticate the industry of prevention, which was quite developmental at the time. So that was a really great project. I remember people asking me, who are you to do this work? And at the time I was chosen because, I did understand the research and I did understand system development. And we were basically that IPS was really a strategic planning and think tank organization, and they understood complex systems and developing complex systems. And I understood that too from my work in the CSU system on the college campus, working with all the different, CSU universities in my research for my MPH. And so I could apply that to the San Diego system, to that developing and contribute back that way.
Yeah, that's awesome that you had the connection from the internship, as well as just understanding how working in one place and understanding the skill sets of understanding a complexity of a system transfers across to other work that you're doing, and just being able to communicate that to the people that are hiring you, I think is very, very fundamental. And then after these positions, you were a data management specialist for underage drinking initiative at SDSU Research Foundation. And then you were also a consultant for Padilla Consulting, which I'm imagining is your consulting company. So tell us about those positions.
Sure. So I was hired to work on that policy panel I mentioned that was started with the Board of Supervisors. They put out a report card on underage drinking and a publication with about 10 policy goals. And so I was tasked with really updating the data, and we had a report card on underage drinking, we had one on methamphetamine, and we had one on marijuana at the time. There are all these different policy panels. And so I was hired to update the data, which was a real, interesting use of my data science skills, I think, as an MPH. I then kind of capped out in the nonprofit sector, and one of the county staff said, you could just start your own business and start consulting. And there was a group in Sacramento that was funded through the state alcohol and drug programs at the time. It was called the Center for Applied Research Solutions. So they hired me as a consultant, and I started working for them. And I started doing projects, and they got a lot of technical assistance requests for training and advice, essentially. And I was one of the top consultants in the group. I was quite young at the time, so I started consulting with the smaller counties in the rural areas in Northern California, and I really enjoyed it. And I was on teams of consultants. We would put together tools to assess the county's needs for public policy and environmental prevention, or doing ordinances searches for them. And I would help clients get data and look at evaluation. And so I really enjoyed that experience. And that was the foundation for my PhD later, which was in public policy and county substance abuse strategic planning. So I really enjoyed those opportunities and working in consultant groups. At the same time, I started getting picked up by federal departments. And I started working with Department of Ed and Health and Human Services, the Substance Abuse, Mental Health Services Administration, which at the time was doing work mostly on underage drinking and drugs, but now they've mostly shifted into mental health. So I started working for those big federal organizations at the governmental level, and started reviewing grants and doing some projects. I did some evaluation projects for states like Alaska and Washington State, looking at award programs. I would go and evaluate the program for a national award. And then I worked on some high level panels for awards and funding through SAMHSA. So that gave me exposure, and I got picked up by many of the departments like Indian Health Service and Bureau of Indian Affairs and Department of Justice. And I started doing projects for them as well, which I do to this day. I review grants for federal departments.
That's really cool. And I like the perspective of you say, okay, well, I kind of like hit my ceiling here in this nonprofit. What else can I do? And then that person sharing that, hey, have you thought about doing some consulting? So to that point, how was that shift to consulting for you? Was that a difficult shift? Was it pretty much similar and just leaning more of like the back end stuff?
It was really challenging, but exciting, to start your own business. And I had a feeder organization through the state to give me work and contracts. I would have like anywhere from 7 to 10 contracts every month. And so it gave me an opportunity to look at deliverables and negotiate my contracts. At the same time, I really had to hustle getting private clients. And I remember losing a client once, for $40,000. I mean, this was like 20 years ago. It was quite a bit of money just for, something I had no control over. So also, I remember having a client that didn't pay me for a grant I wrote and having to hire, somebody to go after them for non-payment. And so you sort of learn, to be a tough businesswoman when you have to have your own business. But it was a great experience. But long term, it wasn't sustainable unless you have a feeder organization or you have a real established business to keep consulting.
Wow, I couldn't even imagine if someone didn't pay me what I would do. But that I think like firstly, I'm sorry that happened had to happen to you. But I think at the end of the day, like all the times we have all these mindsets in our head that, oh, let's not do this because this will happen or that will happen, and it happened. But you're still out here, you're still doing the work, you're still consulting and supporting the work. So like we get through it despite whatever people think is the worst in it. um and that's really cool that you're able to build up your expertise, and then from that people were literally saying, hey, how can we get I guess you weren't Dr. P at this point in time, but how can we get you into this work and doing this work and supporting us in this work, which I think is really cool. And on the sustainability side of things, is it the tough part of the sustainability? Is it like the getting clients all the time, the business development part of it that's hard on the sustainability side?
I think getting clients, there's a lot of competition and evaluation and research. So unless you're part of a research group or a feeder organization, it's very hard to get established. I think one of the things I was reading a book called The Death of Expertise. This sort of falls back upon what I was mentioning with COVID and Dr. Fauci and people not trusting the CDC and experts. A lot of people in our society have lost respect for experts. And there's a lot of competition with people who say they're experts, and they could have a bachelor's degree or even a master's degree, and they're not quite maybe an expert yet. And there's a lot of that on LinkedIn. So you're competing with all of those people too for work. I mean, who may or may not be an expert. And so I think it's harder to get business and get reestablished today because of all the competition.
That's some very valid points there, and definitely things I think other people should think about if they are thinking about going into consulting. Because yeah, those are things you definitely have to consider for your own livelihood. And while you were doing this consulting, you decided to pursue your PhD in public policy and administration, nonprofit management, and leadership at Walden University. Tell us more about that thought process of choosing to do a PhD.
Sure. Well, I was looking at universities. I was in San Diego, and I just love California. I never wanted to leave because the weather and it's awesome bike riding and hiking. But I wanted a different experience rather than brick and mortar. So I looked at an online university called Walden University, and they had a hybrid experience where it was on site part of the time and online a lot of the time. And I thought it would be great to teach online because I was doing a lot of work online, and it'd be great to take some classes online. And I really never thought I would ever pursue a PhD or be able to do it because I was never the top of my class. And back in the MPH days, it was only those top tier students, like the top 5 or 3%, who went on for their PhD. And so I had an opportunity. I was looking at University of San Diego. I had an opportunity to go there and do some work in law and policy. But I chose Walden because I really wanted the technology opportunity and to be able to work out of the home and keep consulting and whatnot. Little did I know that online education really would grow, but not be fully respected. A lot of people still don't believe in online education. The brick and mortars kind of still rule with the application. And so there is not really the full respect with online education as with brick and mortar. But I had a great experience. I was very well trained. I've never met a PhD that wasn't solid. I mean, they don't just give out PhDs. You really have to fight for it and earn it and present your research. It has to be vetted. They have lots of committees, and you write, the master is a book essentially when you do a thesis, and the dissertation is essentially a book also. And so it really gave me a chance to sophisticate my skills and draw upon the research that I had from being a master student and doing the thesis as well. So, I mean, I had a great experience getting my PhD as well and doing the research that was, built upon the work I was doing consulting.
Yeah, that's awesome. And that seems like a good fit for yourself, and also like supportive in continuing to do the consulting while also building out your expertise and education in this PhD. So what did you specialize in from your PhD perspective?
So my PhD was in public policy and administration with a focus on nonprofit management and leadership. I really focused on the public policy aspect with the feds, essentially mandating that the counties focus on strategic planning. It was somewhat broader than that because I really saw myself working on policy issues and substance abuse when I was done with my PhD. So I focused on really that issue of substance abuse and prevention and strategic planning, really at the local level with the counties, but also at the national level and international level in terms of the countries. Each country has a strategic plan in terms of drugs too. So I was looking at some international strategic plans and really developed a tool and looked at software and chose software and developed a coding system to evaluate the strategic plans. So it really gave me a lot of takeaways and expertise. But when I finished my PhD, by then the mental health crisis had already been and gone, and SAMHSA was shifting into mental health more so than drug prevention. So there weren't really jobs in prevention with policy for PhDs when I graduated. And so I kind of had to rethink my strategy from then on. But it was a great experience. And now there's still a need for a lot of strategic planning now. So I can still use my skill sets.
Yeah, absolutely. And you shared a good bit of insights and knowledge a little bit earlier about that strategic planning expertise, which I think is appreciated. Also, while you're doing your PhD, so you were consulting for Padilla Consulting. You were also a consultant subject matter expert for the U.S. Department of Justice and a representative for the USA at Faster Capital. Can you tell us about those experiences?
Sure. So I was working in China at the time. I was teaching business, and I started teaching in Vietnam on a quarterly basis. I trained MBAs there, and I just loved it. Everybody loved being in Vietnam, and I was doing my lit review at the time for my PhD and traveling around to foreign countries in Asia and just absorbing the culture and the language and all the traditions. And so I basically was teaching business in China after teaching business in Vietnam. And I connected with a company in Dubai, and they were in fundraising. And so working in the nonprofit sector, I always had worked in fundraising, writing grants, evaluating grants. And so I got involved with a funder-founder model, so they would fund entrepreneurs. And at the time, I was training entrepreneurs in strategic planning and writing business plans in China. And so I would work with my colleagues. I did some public relations for this Faster Capital in Dubai, who would be looking for clients to essentially fund the research, but be expected to be a founder as well. So it was quite interesting, and it broadened my horizons in terms of global organizations.
I think quite interesting is an understatement. That's a lot more than quite interesting. And then on that point there, so you taught business and English overseas in China, Vietnam, Saudi Arabia, and South Korea. Tell us, what did you learn from that experience?
I learned to be agile, to be flexible, because a lot of the housing situations, like in South Korea, was random. We were on the campus, then they moved us into a hotel in South Korea, and you have to understand and respect other cultures. For example, the culture in South Korea is like they have a lot of prostitution there. And here that's illegal, except like maybe in Nevada with prostitution. But there they see it as an opportunity for a man to have an intimate time with his wife, because the parents might live with the family. So they might get like a hotel room just to have some intimacy. And so we really can't judge like those prostitution hotels as just scandalous, for example. And so we stayed in this hotel, and they had some, prostitution going on, but it was not like on our floor. But like, they expected us to like, share a bed with like another American, like a girl, like I really didn't know. We had to like sleep in the same bed, or then we got our own bed, and we would kind of share our expectations with our boss and say, this really doesn't work or something. But I learned a lot about culture and about values and about education systems and kids. And because I was a PhD, they gave me the best kids in South Korea. They gave me the kids who wanted to be doctors and astronauts. And I had a lot of opportunities in China and South Korea to take a leadership position with the staff and help out with the curriculum and the other teachers. And there were a lot of African Americans. There were a lot of PhD students in South Korea at the time, and they pulled them in to teach the English. So it just furthered my experience, wanting to learn and learning about African culture while in South Korea as well. And we ate with the kids. We ate kimchi, in the morning, and we observed their traditions. And the ladies would size us up, and if you were a little heavy, they would give you like less food. Because Americans, like, we're known for eating a lot and being a bit overweight, things like that. So I learned about their culture and their traditions, and teaching English. And
that is fascinating, and it sounds like a beautiful experience both for you and for all the people that you got to interact with. I'm sorry for the interesting sleeping situations here and there, but once again, you got through it. You got through it, and I guess came out on the other side positively and understanding and appreciating cultures even more.
Yeah, it was amazing experiences.
Yeah. And did you have any takeaways from your PhD program that you wanted to share with us?
I think you have to learn to be resilient and work through it. The PhD is a political process. They don't really give those degrees out. You have to really fight for it. And you have a committee. And I had an all-female committee, which, when you get a group of girls together, they can argue. And especially PhDs, you're talking about egos as well. And so I remember writing my abstract, like maybe 20 times, and being held for a couple months. But there's a lot of hazing and abuse in the PhD system in general. So you have to just kind of be careful and watch out and grow from it and learn from it, and really politically maneuver your way out of the system. So you have to be politically astute as well. And I got out of my PhD in 5 years, which is really good. They give you like up to 9 years in some universities. So I think just maneuvering and enjoying it, and having relationships with your colleagues. And not everybody makes it out of a PhD program. I remember, some people had to leave because they couldn't get the research off the ground. They give you like a couple opportunities to propose your research, but you really have to have it solid. And if you can't get your research off the ground, you're out. You get dismissed. And you have to keep like a 3.0 or you get dismissed. You have to keep the academics up and be smart about the research. And I saw a lot of people struggle because they couldn't handle the APA, the documentation. And because I had a strong master degree, I could handle the APA system and all the documentation that needed to occur as well. So I was quite thankful.
Yeah, and that goes back to that point that you were saying, like, if you have the opportunity, take on the rigorous Masters of Public Health thesis work so that you're able to just be more well-equipped as you're going into that public health program, as well as probably have a better understanding for, like, what is that topic that you want to do, which I think is probably not half the battle, and maybe a third of the battle for many PhD students.
Yeah, definitely. I mean, when When you're seeking a PhD, you're looking to contribute at a very high level to advance and do novel research, something that hasn't been done. And so it has to be valuable, it has to be novel and original. So you have to have kind of like a real niche area for, it has to be beneficial to society.
Yeah, absolutely. Absolutely. So you currently work in 3 different positions. I'm going to name all 3 of them out, and then you can tell me what you do in those positions.
Sure.
So you're an associate at Interim Public Management. You are a chair for the grants committee at the U.S. Department Health and Human Services Family and Youth Services Bureau through F2 Solutions, and you are also a substitute teacher for preschool and K through 12 at Mesa Public Schools.
In Mesa, right?
Mesa.
So I signed up with a consulting firm. It's a staffing firm called Interim Public Management in Arizona, and they hired me to serve as both as a consultant and as a manager to strengthen a municipal operation called Community Action Program. So it was a food bank and a human service project to pay rental, utility support, and water support in a very poor town called Guadalupe. It's a very small town in Arizona, about 5,000 people. So I worked there for interim public management. At the same time, I continue my grant work with the feds, and I often facilitate the committees. I don't always read the grants. Sometimes I help facilitate the committees, making sure other people are reading the grants and are having good evaluative critiques. So I do that work as well. For example, because of the abortion laws being rolled back, Department of Health and Human Services put out like pregnancy prevention programs. So that's a way that they respond to the rolling back of like abortion law and policy. So I worked on that project recently. And then I work in the public school systems. I've worked at over 50 of the schools and provided education. And oftentimes you're falling back on your consulting skills to basically come up with a lesson plan, quickly for the kids and, screening some of the kids. You always have to keep your eyes out for, the mental health issues and that type of thing. So it's all a very interesting experience.
Yeah, that is quite fascinating, and that's kudos to you for being a substitute teacher, being able to work and impact lives in 50 different schools. That is pretty wild to think about. But thank you for that work as well as the other work that you're doing.
Pleasure.
And then before we move on to the final section of the show, I would like to ask, where would you like to see yourself in the future, and where can people connect with you?
Sure. Well, I'm a leader, so I really would like to get further into municipal management and be a deputy city manager, town manager, and have a leadership position there or a director position in public health. I really am an advocate and a leader. So I'm interviewing in Arizona with the governor's office, and I'm putting my name in the hat for a couple of the towns to lead as a town manager, which I did an interim town manager position in Maine. So I hope to be doing something like that soon and contributing at a higher level in society.
I love that. I love that. And I think we need more town managers, county managers, but people with public health backgrounds in those types of positions so that we can really have that holistic view of not only what is going well in the town, but how can we work with the communities to improve and ensure that they're thriving and happy and whole. So look forward to that. I wish you well in getting to that position. And I know that you're going to do phenomenal work.
Thank you.
You're most welcome. So moving on to the Furious 5, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Try everything, volunteer, get every intern you can, seek scholarships, just try everything, volunteer, get internships, experience different programs and projects, get solid on the research as well.
Great insights. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Read everything, evaluate everything, study different domain areas like law and business, because you don't really know where public health is going next, where the field's going to end up. And so having varied skill sets, I think, will help you get a job. And also multiple languages, like learning Spanish. Mexico is going to be a big training partner with us in the future. With the, we're rolling back on globalization and internationally, and so our partners' relationships with Mexico is going to be very important. So learning Spanish and also learning, about the Canadian culture and maybe some French, because the NAFTA 2, our trading partners with Canada and Mexico, are going to be very important in the future.
It's great insights. Number 3, what's something you are working on improving in your life right now?
I'm still working on my Spanish, un poquito español, so I'm trying to speak more Spanish. There's a lot of kids in the public school system who don't speak English. Right. And so they're just lost. The other kids are trying to translate for them. And so I would like to work on improving my Spanish. I'm also learning more about municipal finance with issuing of bonds and public finance systems and software and those types of things as well.
Okay, that's awesome. And 2 things I think language I've probably heard before, but the municipal bonds and leading all of that stuff, I have not heard before. So thank you for sharing that. Number 4, professionally, do you recommend anything?
I do have a book if you want to seek a PhD. It's called The Power of a PhD, and it's by Dr. Isaiah Henkel, and it's Hankel, and it's called The Power of a PhD, and it really talks about the job process, what PhDs bring to the table in terms of our value. Also, if you are the kind of person where you would like to ask a lot of questions, you're not, satisfied with the status quo, and you really don't know who you are, and you have to keep learning, you are probably a PhD or, cut out to be a PhD. And so this book was really a reflection of who I am. And I never knew why I have to keep learning, why I have to keep contributing, keep pushing, keep advocating. And so that book is a real good tool. And there's a national association called Cheeky Scientist Association. And there's a lot of PhD MPHs in that group. There's probably 5 or 10 of us globally, but it's a huge international group of PhDs. It's a real community. And I really recommend it in terms of career growth and just the networking opportunities.
Yeah, thank you for sharing that, and I'll be sure to link those in the show notes for anyone that's interested. Number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I think learning about finance, more about finance. They're doing that in the schools now, but I really didn't know how to finance my education and work on the student loans, for example. So I think having a greater sense of finance, and also taking up opportunities. I was offered to get an emergency teaching credential in California, and I turned it down. I always regret that, because that would have served me well, because even as a PhD, you're not really a credentialed teacher. The system doesn't really work that way. You have to have a credential. And so I would just recommend other MPHers to look at opportunities as they present themselves and explore the opportunities, and they could benefit you 10 years from now. You just don't know. And when you're young, you don't really, sometimes you don't really think through the decision.
Yeah, absolutely. Well, thank you so much. I appreciate those insights, and this conversation was a great one. I learned a lot of stuff, and I enjoyed hearing about your progression and your story, and I look forward to seeing where you go in your career.
Thank you. It was great chatting with you, Amari. I look forward to following you as well.
Thank you so much, Dr. P, for making time. I appreciate it a lot. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a review and share it with a friend, someone who can get some value from it. So be sure to like, review, and share it with a friend. See you all next week. Bye.